I am a sickle cell mom. And what does that mean? That means that my son has sickle cell anemia. It is a disease that is, you see it more predominantly in African American community. It's a genetic disease, and it has, a lot of complications that go with it. And so there are several different organizations and alliances throughout the country that utilize the month of September to recognize that this disease needs more research and more support, and just making sure that we educate the community. So I'm so excited to have the folks from Prestodoctors and Keystone Canna Remedies. What's going on, guys? Hi. How's everybody? Hello, hello, hello. So let me start. I'll start with you, Victor, and Keystone Canna Remedies. Tell them who you are, Victor, where you're located, and a little bit about your organization.
Sure. Thank you. Thank you for having us today. It really is just, it feels good to get kind of back out there, even though we're not, and just get talking and raise awareness about these things. So I'm Victor. I'm from Keystone Canna Remedies. I'm the co-founder. We were the first medical marijuana dispensary established in Pennsylvania in 2018. We run a very patient-focused pharmacy model with education at its core. So we're medical professional led, and we're family owned and operated. So it's been a big endeavor for the last 3 years, but we've really made a lot of difference in patients' lives, especially with chronic care conditions like sickle cell.
Mute myself. That's awesome. Thank you so much for being with us, Victor. Okay, next we got Rob. We got you going on, Rob. Introduce yourself, Rob. Tell us where you're located. Wherever you are, you got a nice little skyline going on there, brother. And tell us a little bit about your organization.
Thank you. Hi, everybody. My name is Rob Tankson. I'm the co-founder and COO of Prestodoctor. Prestodoctor was the first company to offer telemedicine in the cannabis industry. And what that means in layman terms is we help people get their weed card online. So as opposed to having to go into clinics, which at this time is obviously not the safest route, talking to a physician online is a very convenient way to do it.
That's awesome. So Rob, you guys tell them where you're located and how you started. Tell me, because you were telling me the story of with Prestodoctors. If you guys haven't heard about Prestodoctors, what's your story a little bit?
Yeah, so Prestodoctor, we started the company in 2015, launched it in the state of California. Learned a ton in the first year, and from there we're able to expand to different markets. So currently we're operating in California, Nevada, New York, Oklahoma, Missouri, Pennsylvania, and Illinois.
Awesome, 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 awesome. Thank you. I'm so happy to have you. We're trying to get you in Florida, right? We had backdoor conversation. I'm like, come on, Rob. So our next person, I know, we're going to talk about it offline, right? So our next person that we have, and I'm kind of skipping around. I should have gone to this young lady beforehand when I talked about Victor, and Victor introduced his company. So forgive me. But next we have Shelly. Shelly, tell us who you are, where you're located, and a little bit about yourself and your role with your organization.
My name is Shelly Blake. I'm one of the pharmacists, the many pharmacists at KCR. It's 7 of us, and we also have a staff of healthcare professionals. We have a physician assistant as well as a cardiologist. And what we do there, like you said, we're very patient-based. So as a pharmacist, I do the initial consultations when patients come in. So basically on their intake, I go over their disease state of sickle cell. I look at the medications that have worked for them and not worked for them. And basically, I just try to get an idea as what they're trying to, treat and target that pain with the best recommendations that we have. Been practicing over a long time. So I've worked for retail and I'm really enjoying this. This was a new avenue for me. So having had both sides of the spectrum as the retail pharmacist and now working with a family-owned business, it's actually filling that void that I just didn't know how to get it filled. So I do appreciate working with a company that's very patient-based, and we're very bent on education. We try to educate our patients so they can be more comfortable with using the products, feel more comfortable with even talking about the products. Thank you for having me.
Isn't that kind of cool? Thank you for being on. Isn't it kind of cool how you can work retail all those years and now be able to transition your career into something that it feels more fulfilling and more like just a connect? I mean, I don't know. I would think so, but I don't know.
It is. Yeah, because commercially, you know how much time we have with patients in the retail world.
Very little. I just went off on the pharmacists at Publix. I was like, excuse me.
We're the total opposite at KCR.
Yeah.
The total opposite, and I really appreciate that. We get to see the progress. We get to see how medications are working for patients. We actually encourage them to go online, let us know what things are working for them, and based on their disease states, we can do good, patient by patient references. What worked for one patient will say, what, someone else tried this and they're suffering from the same thing. So it's a really great company in that sense.
That's awesome. Quick question before I go to Dr. Terradas. In Pennsylvania, is that pharmacist required? Is that a requirement by law to have someone, a pharmacy, a licensed pharmacist? Is not?
Not at all. So that's why the company is really special. Yeah.
That's very
not
special.
At all. Yeah.
All right.
They took the time to make sure they give their patients the best.
That's awesome. So for you guys that are listening out here, because we got a lot of people that some people they know about the industry, some people that don't know about the industry. One thing that happens is when they create licenses to be able to render medicine, cannabis for patients, that license will tell you what you have to do in order to be in compliance. And one of the things in some states that you see is that you have to have a pharmacist on board to be either to do compounding or just to be a part of the whole entire organization structure to lend that support from a professional's perspective. So to have an organization that there's not a requirement to do this, that has this piece to it, kudos to Keystone and what you're doing, guys. I love it. That's awesome. So next, Dr. Terradas, how are you, my love? Welcome to Canna Talk with Roz. Tell us a little bit about yourself, where you're located, and your background.
All right, I'm feeling like I'm in some pretty esteemed company right now.
I know, me too. Yeah.
My name is Jose Terradas. I am located in Pennsylvania. I'm about an hour north of Philadelphia. I grew up in the area, but I've worked as an ER doctor in California, New York, and this area as well. I joined Prestodoctor probably about April, May of this year, especially with COVID, the pandemic, people having difficulty accessing their doctors' offices sort of in the more traditional setting. We're seeing an explosion of telemedicine interest, both on the patient and on the provider side. So Prestodoctor is an avenue that I've been exploring a bit to sort of give access to patients who may not easily be able to access somebody in their community, either because they're not comfortable doing it, their provider may not feel comfortable recommending it. And so we're kind of helping to break down the barriers that exist. But thank you so much for having me.
No, that's awesome. Dr. Terradas, can you talk about, like, you are an ER doctor by trade, correct?
Yes.
Can you talk a little bit about, when you've seen sickle cell patients in your, coming through the ER? Because I know I've been in the ER in many hours and the range from children to adults. How is that experience, and and maybe talk a little bit about the disease and what some of the symptoms and what patients deal with?
Sure. No, great question. So not even every doctor is very comfortable managing sickle cell disease, because if you do not live in an area with a significant Black population, you really don't see sickle cell too much otherwise. I did my training in Philadelphia and New York, so very familiar with it. So just to give patients, just everybody listening, just a very basic background. So sickle cell is basically a disorder of the red blood cells. The red blood cells travel in our blood, in our arteries, in our veins, and carry oxygen to every part of our body. They're supposed to look like little discs, little frisbees, but in patients with sickle cell disease, for a variety of different reasons, that blood cell loses its shape and looks like a small little crescent or a sickle, and that can get stuck in the blood vessels. That can cause clots, that can cause very serious complications, basically every single organ in your body. And my first exposure to this when I was in residency in medical school in Philadelphia was, there was this poor kid, it's like 18, 19-year-old Black kid, who every single morning would come in because he would have an erection and it would not go away because the sickle cell was affecting him down there. Yeah. So almost every single morning he'd have to come to the hospital and get a needle put down there for, imagine the life, the mentality, everything that is involved with it. So sickle cell is very real. It is a chronic condition. Anybody who has experienced it, who has lived it, knows that it is absolutely no joke. And it's something that requires a lifetime intervention. And so that's why I think we're here today to talk about where does cannabis fit in that space.
Absolutely. So for those that don't know, there is no cure for sickle cell, right? So it is a disease that there is no cure. There is different treatments, and there's things like, bone marrow transplant that is a very, complex type of treatment. But to say that there is a cure per se that eradicates that disease, which is genetically, it happens genetically, there's not. And so everything that's being done for these patients, from the little ones that are born that turn into 2-year-olds, that then turn into 6-year-olds, that turn into 15, that then turn into 20 and 25, and and older and older, you're managing the disease, wouldn't you think, and all those symptoms that go with it.
Oh, you are absolutely just managing it for sure. And the other issue is that the reason it's so predominant in the Black community is because if you have the trait, so basically we get diseases based on our DNA, and if we have 2 copies of the same gene, so somebody has sickle cell trait, they usually just have 1 copy, but the other copy is okay, so they're generally less symptoms or no symptoms. But if you have 2 copies that are both wrong, then you have the disease, and that's where you get into problems. And so unless we get gene therapy or some type of cell-based, molecular-based treatment, just like you said, Roz, everything right now is just management of symptoms and keeping the condition at bay.
Wow. So let's talk about, the patients that you see, and the knowing that, okay, so another point for everyone is knowing that when it comes to medical conditions where you can get a card, a medical marijuana card, there are certain ones that each state sets out, they outline, if you have this condition, this condition, this condition. The one thing that we're trying to do as an organization at a national level is to get more states to really recognize and specifically state that sickle cell anemia and the disease itself can be considered a condition for the use of cannabis. Can you talk about, Doctor, and then I want to go and talk to Shelly and talk to Victor a little bit from Keystone's perspective, why do we see cannabis as another option, an alternative option for these type of patients?
So the good thing with, even though not every state has sickle cell listed as a specific condition, once you see the type of pain requirements that sickle cell patients have and the amount of usually opiates that patients are taking, that generally will qualify them into a chronic pain category, even though sickle cell should absolutely just be its own thing.
Right.
So since we're not talking cure, you're talking about management of symptoms, lifestyle improvement, mental health improvement, withdrawal and side effects of medication improvement, safety, etc., all these things. So for me, it's about trying to find alternatives for this patient population who absolutely need to have more light shed on the problem.
Yes.
And the reality of their symptoms cannot be minimized because it's very real.
Absolutely. Not Dr. Shelly, but Shelly, question for you. What type of research do we know quantifiable research that's been done with the use of cannabis or even CBD to support those patients with sickle cell anemia, or what things are we seeing out right now from your perspective?
There's been quite a few studies done, but the unfortunate part of it, it was done during a time when it wasn't legal.
Right.
So a lot of the results that are based on what was being used, for instance, in 1994, there was a study done here, and I'm from Brooklyn as well as Victor, but here in Pennsylvania, in Philadelphia, they did a study, an engineering and medicine facility, and it was done in 1994, and they followed patients up until 2009. It wasn't legal at the time. So the results that they got back from it a little bit skewed because they were basing it upon the use of cannabis in patients and considering, the vaso-occlusive crisis that can take place when using THC. Yeah. However, we know when you don't have a quality product, you don't know what was in it, you can't totally base those results on good cannabis.
Yeah.
Just in short, you know what I mean? So there are studies that have been done. However, you have to kind of look at what the time frame was,
Sure.
before you get, and right now we don't have enough data to really show the results of it. But hopefully with this going on and with it becoming more approved, because right now, as of 2018, 33 states were approved,
Yes.
to use medical marijuana. Right now, with sickle cell being a certified disease state, it's available as West Virginia as a disease state, in Pennsylvania, in Ohio, in Missouri, and Connecticut. So only a few have it put on their medical marijuana list. So hopefully that can broaden, and with that, hopefully eventually more studies can be done.
Yeah, so when are we studying, and I don't know, and this is a hypothesis maybe, and this is where Dr. Terrados, you can go in as well. Are we looking to study the effect of the cannabidiols on controlling pain, or maybe looking at how they affect the red blood cells and maybe provide more oxygen, or utilize the plant to provide more oxygen to those red blood cells, which will then maybe help with supporting less crises? If we had to make a hypothesis or guess, like where should our studies focus on, with your thoughts?
Well, with the endocannabinoid system, which is what the cannabis works with, our endocannabinoid system, which is a system that is in complex animals as ourselves, from fish to humans. So we all have them. However, the CB1 and the CB2 receptors is what the cannabis acts on.
Right.
So most of the studies in the literature that I've read have all been talking about more so the management of pain and trying to track in retrospect the number of visits to the hospital, things like that. So I think they're more so moving into truly the pain management of it. There's the drug that we mimic, the synthetic drug Marinol, which is supposed to mimic THC. So yeah, and that was used more so with chemo patients with nausea, vomiting, but it's also used in a lot of sickle cell patients as well. And there's other drugs that are in Canada. I think it's called Sextiva. It's not approved here, which is made actually from the plant. Okay. And they've shown that it relieves a lot of pain. Yeah, but we don't have it here in the States.
Yeah, and there's something to be said, Dr. Terrados, if you want to talk about that entourage effect of having that delivery system of that cannabis to have, some people say, well, just give it CBD, but there's something to be said about that CBD and that THC kind of combination that really helps with sickle cell patients. Your thoughts?
Yeah, I mean, the two definitely work synergistically. I've definitely had patients who have used cannabis more obtained, not through a dispensary, who say that, well, CBD just doesn't work for me at all.
Right.
There's definitely growing research that shows that when used in combination, that the synergistic effect from a pain anti-inflammatory component is definitely there. There was just recently a study in July of 2020 out of California, UC Irvine, where they talked about it was sort of the highest level type of study, which is a placebo-controlled, blinded and randomized trial. So people don't really know what they're getting. It seems like the one area that it truly did improve was in how it affected mood and pain and mood elevation, not even necessarily controlling pain purely per se, but what effect did that pain have on your activities of daily living? Because that's what you're talking about as well, right? You can have pain, but is that pain so debilitating that you don't do anything else for the rest of the day? Yeah. So it's pain on one side, and then it's also side effects on the other. I mean, as an ER doctor, I see patients who are dying all the time. And the amount of patients I've had to tell their family members were dead because they took too many opiates. Yes. I could count on thousands of hands, but in terms of with cannabis, I've never told a family member that their loved one died because they took too much actual cannabis. Synthetic marijuana is a different story, but that's another reason that we should be regulating actual cannabis, because the side effect profile and the withdrawal profile is nothing compared to opiates.
Wow. So, when you think about this, and for those that are looking at it right now, and I know we got people that are viewing this or what have you, the one thing that to be expressed is the fact that individuals that are dealing with, with these pain crises or what have you, that to manage that and to be able to, when you talk about taking things like morphine and Dilaudid, the effects of that after you take it for so many days at a time. I know with my son, he would be lethargic, he would be tired, he would be drowsy, and he's expected to go to school and feeling so pull down. And then, of course, what happens as he comes off of it, he starts feeling better, then it messes up his sleep. And so he has sleep issues. It's a host of things that go on, you know. But, you know, let's talk about, you know, going from Rob and talking about Presto Doctors, you know, talk about the process. What do people do with Presto Doctors? I know in some states there's telehealth, but talk about your process when you are seeing patients. And then also, how do you set your fees? And do you do it so that if there's ever a time when you have someone that can't afford it, how do you support those individuals that may not be able to afford certain fees when it comes to getting a recommendation?
Sure. So, you know, as far as the first question about, you know, what it is that, you know, we do. I know, Roz, you know, on your shows in the past, you talked a lot about healthcare equity. You know, a lot of patients don't have the ability to find the right physician because of the fact that they are, you know, tied up with things. They don't have the actual time, you know, or money to travel. So Presto Doctor being an online solution kind of tackles that issue. Some patients are debilitated. You know, they physically can't make it to see a doctor in person. You know, so telemedicine is a very convenient option for that. And, you know, patients that, you know, have, you know, like, you know, problems paying, we have programs for that. We also do certain donations and certain programs for retired military personnel.
Yes.
Providing them a certain number of free cards every month. So we definitely, you know, like take care of people because our biggest thing is access. Like we want to get as many patients access to the plant as possible.
That's awesome. And so for those that are out there, you know, want to explain and even break it down further, again, we talk about legislation and the policies and how you create the rules. In most states, you have to have a face-to-face interaction with a physician, a recommended physician, in order to establish a relationship and get your card. In some states like California, you don't have to have that. You can actually interact with through a telehealth option and be able to do the same thing that you would do with a doctor. And let me tell you guys, telehealth works. My kid had a dermatologist appointment and it worked like a charm. So the flagrant kind of like almost kiboshing of access to patients, saying that telehealth should not be utilized for cannabis, for me, I don't know about you, Rob, but it really kind of infuriates me, right? And I think people need to understand that we can get our legislators to change that. You can ask them, hey, why are we not having telehealth as an option for cannabis patients, especially with COVID-19?
No, exactly. That's exactly spot on. And you know, fortunately we've seen a lot of states, you know, overturn those, you know, initial appointment in person. Like Pennsylvania was one. We were actually live in Pennsylvania, you know, about a year or so ago, and then they changed the law, and then now because of COVID, we're back. New Jersey recently, you know, allowed telemedicine and cannabis. Florida, I'm sorry, Roz, unfortunately, is one of those states. It's just, you know,
it's hard. But this is why we need you guys. So we need you folks become an advocate. Help us when we do lobby days. Write to your congressman, your congresswoman, whatever the case may be. You know, your senator and your state rep, and say, hey, listen. You know what? With this medical program, we want to make sure that, you know, we have option and not have to go into a physician's office. We want telehealth. And I think, you know, it's going to come up as a conversation in Florida, but I think we have to really push that together. You know what I mean?
Yeah, no,
we got Herman Brown is on, and he's a patient. Herman, I want to welcome you to the show. How are you, my brother?
I'm good. How are you? Thank you.
Good. Herman, tell us, Herman's just getting off work. He's been working, but tell us a little bit, introduce yourself, tell us where you're located, and tell us a little bit about your story, you know, being a patient, and when did you first realize that cannabis was an option for you as someone who has sickle cell?
So my name is Herman Brown. I'm 33 years old. I actually suffer from sickle cell, SC, disease. So I've been in and out of the hospital all my life. I've been on fentanyl, morphine, Dilaudid pretty much a majority of my life. So I've been through like minor strokes, cardiac arrest, so on and so forth. I actually just had a port removed from my chest 2 months ago today, where they actually cracked my chest completely open. So I'm cut from here pretty much down to the center of my chest. But I actually met my recommending physician in the hospital while I was an inpatient. And he came in and gave me the whole spiel of, you know, I really want to help you and figure out a way to keep you out of here. because he said that he actually had read over my chart, and I was in and out of hospital literally every 2 weeks, probably since 2009, 2010. So been working full time all the way through it. Flew up and down the East Coast for Charles Schwab, did their system upgrades. And then, so I gave him a chance after kind of talking to a cousin of mine that worked with Dr. Fletcher. And that was really what actually made me kind of take that leap of faith. So I had already been using cannabis recreationally to kind of self-medicate before then. But it was more or less along the lines just to kind of escape reality and everything that came with it, just because a lot of the physicians understand the disease, especially in the hospital.
Yes.
I actually got admitted. The man that really pushed me in the cannabis was I actually got discharged from the hospital, and didn't give me anything to come down on. I had been on 2 to 3 million hours for 2 weeks straight. Gave Fletcher, and I was like, hey man, like I literally feel like I want to die right now, just because of the simple fact that like I didn't know what to do. And so every time I went to the hospital, I was being told I was a drug seeker, when more or less like I'm just trying to get out, get through the pain. And so let's kind of fast forward. Pretty much he taught me the entourage effect. Truly was the only dispensary around that I could get from. So it was pretty much ACDC, which is a high CBD flower, and a hard 9-pound hand. Learned how to entourage that, and then that kind of, so after pretty much about 3 months, I mastered my regimen, completely off of every single medication I've ever been on, from any antidepressants to opioids. I'm completely off of. And then he actually ended up hiring me as his lead patient educator in his office for about a year. And then I actually just left from there, and I just started working for a dispensary here as well. So
Wow.
that's pretty much my story.
That's your story, Herman. Oh my gosh, you make my heart just like, I mean, you are the poster child of what we're talking about. And we know that it doesn't work for everyone, but the gives option. Victor, I see you shaking your head like Keystone. When you think about that experience, talk about what people can expect when they come into your dispensary, and what you're trying to do. Where are you trying to create that environment of conversation and getting people to understand how to make themselves feel better?
Yeah. So,
For me,
Oh, that was for Victor. Hold on, Herman. Yeah.
No, and honestly, what we start with is like an initial consult. So I think what makes us different is that we actually require you to sit down with a medical professional, usually a pharmacist or a physician who's on staff. We don't charge for that consult. And what we're doing is onboarding you in a way to educate you how to use cannabis, right? And we want to make sure that you know that you can use our dispensary in whichever way you want. So if you do understand what you need and what you need to get, then we could guide you in more of a sandbox approach, where we're setting up parameters on where you'd like to get to. Or we could take a much more hands-on regimented approach, where we take a ladder approach, where it's a much more stepwise fashion. So we're going to start with that onboarding, right? And we're going to educate you that what we're trying to do is using a layered microdose approach. So we're putting small increments of an increased dose to get to a sweet spot of alleviation of symptom and functionality, right? So I think that's a conversation that many people don't even have. And we have that conversation with every patient that we can. And so what we try to do is show them the difference between inhalation and an oral route, right? So inhalation may be better for your acute pain relief, and then an edible or a capsule or a tincture is going to be better for your long-term pain relief. We're going to phrase it in terms of cannabis goals, your therapy goals. What are the symptoms we're trying to get under control, right? And a lot of the times we'll have these conversations with patients and they don't even know how to answer it, because nobody in the medical community or the healthcare community that they've come across has asked them what their goal is. So what is your goal? And I think part of this conversation, and everybody, what you're hearing is that cannabis has a very systemic effect through your system, right? And that's a large part to do with your endocannabinoid system, but it's also why it's so prevalent in a lot of these chronic care symptom management cases, which sickle cell is. I mean, it's severely, and I mean, your story is amazing. The fact that you were working through that, I mean, that's insane. But I mean, that's testament to you. But do you want a job? No, I'm kidding.
It says a lot because I will say this.
I don't even give you a job. You want to be a partner, really? That's what I mean.
I mean, and this is what we look for. I mean, and seriously, there is a population of patients. There's about 120,000 people that are afflicted with this disease. So it's not like millions and millions, but when you talk about, just what these patients have to go through and having to learn how to manage that. And the fact is, you never know when you're going to have a crisis. That crisis could happen. You could be walking down the street, you could be, asleep or what have you. And the thing about it is it moves throughout the body. So it's never in one place. With my son, sometimes his legs, sometimes his back, sometimes his arm, it moves around. There's something, and Dr. Terradas, you could talk about that's really critical when you come into the ER, a chest crisis, when you have talk about those symptoms and how is critical is that when you're dealing with that, Dr. Terradas?
Oh, I mean, it absolutely can be a life-threatening disease. We call it acute chest syndrome. But basically, you're getting a vaso-occlusive crisis, like Shelley was mentioning before, where you just get these little blood cells that just clump up on it with each other and just prevent. It's like plumbing in our body. We need oxygen and we need to get rid of the toxins, and that all happens through blood. But if through this little tube you can't get anything through it, I mean, it can be a matter of minutes before somebody is dead. These people usually need very aggressive management, can need transfusions, can need what's called plasma exchange.
Sure.
And these are not simple procedures to do. And patients with sickle cell know the reason that our guest has a port in his chest is probably because he doesn't have any veins left in his arm because he's been stuck a jillion times. And so that complicates these patients even more, is that it's a life cycle of pain. So kudos to him.
Thank you.
But yeah, acute chest syndrome is very real.
It's very real. I know my son was in ICU twice because of that. It literally, in our whole blood, in our whole body, we have red blood cells, and that includes all of our organs. That includes your lungs. And so just imagine having a crisis basically in your lungs, and not being able to breathe. And that it's just heartbreaking to think about it, and knowing what these patients go through. I want to tap into something that Herman talked about a little bit, and he talked about the entourage effect and ACDC and the high CBD. And one thing that we are seeing now in cannabis is that, initially it was hard to kind of figure out what works, and also about dosing. And so I would love to get, Dr. Terradas and Victor, as well as Shelley, talk about how you work with patients when it comes to trying to figure out where your fit is. Where is that? Like, what do you recommend, even from a dosing? And then maybe, Shelley, you could talk about the different delivery system. It's not always, we're not out here just blowing smoke. There's so many other different delivery systems. So go first, Dr. Terradas, and then maybe Victor, talk about that conversation that you have with patients, and then Shelley, share the different delivery systems.
Yeah, I mean, Victor actually said it really nicely before, right? It's about taking a slow, stepwise approach to finding where you can relieve symptoms, but manage side effects and be functional, right? I think a lot of people, especially with ingested routes, with the oral routes, I think a lot of people, their exposure to it has been a brownie that somebody made years ago, and you have no idea how much is in it, how much you're getting, what you're actually taking of a strain, what a drug dealer may have put in that strain before you even took it. I mean, there's so many variables when it comes to cannabis, and what's effective for anxiety versus what's effective for chronic pain versus, what's effective for. So it's not a one size fits all model. So most of the times with the patients that I'm seeing on Presto Doctor, every time they get a recommendation, I say, you have to talk to the medical professional at the dispensary because they are your best contact at the store. And then also we're just describing CBD, THC, how they interact, and then sativa, indica hybrid, and then based on when they have their symptoms, what is the most specific symptom they're trying to treat, give them a bit of a rundown, but at the
Yeah.
end of the day, I put it to Shelley and the people on the ground to guide patients more to what they actually have in-house to find the best solution.
Absolutely.
Yeah, I'm so encouraged to hear that too, because I think that's something that we have tried to do is make physicians comfortable with dosing at the dispensary, right?
Yes.
And that's not the case everywhere. And that's what we've been doing for the last 3 years is making sure that physicians are comfortable with their patients with us, right? And that's
Yes.
why we take such a hardline approach there. And I mean, so a large part of what we're talking about is like, if you could answer 3 questions with a patient is what's in the plant, how does it affect the body, and then how do I control that interaction, right? So what's in the plant? Your main medicinal drivers are CBD and THC, right? And honestly, your main medicinal driver is THC. It's your anti-inflammatory, it's your pain alleviator, it's your mood modulator, right? And it's your regulator. CBD does have medicinal benefit in its own right, essentially mostly as an anti-anxiety.
Right.
It has some nerve pain and has some anti-inflammatory effect, and it does have a lot of effect in nerve pain aspects as well. But what we were mentioning before is that 1-to-1 ratio or well-ratioed products, what we find actually opens the therapeutic window and allows patients to find a sweet spot of alleviation of symptom without experiencing the psychoactivity, right? So we really use CBD to actually buffer the high effect of THC, because THC is really that main medicinal driver that's going to give you, and even especially for sickle cell, those particular disease states and those symptoms are what's being alleviated. Is the THC is what's really alleviating that, right?
Wow.
But we're talking about is entourage effect too. So that's a ratio, your cannabinoids, and then there's the other subset of the plant, which is terpene, right? And terpenes is all the rage right now. And that's your aromatic compound that's responsible for the flavor and the smell, but it's also responsible for that spectrum of effect from wakeful promoting to sedating, right? Essentially sativa to indica and everything in between, right? So you have something that's uplifting and energetic, you have something that's calm, cool, and focusing, you have something that's relaxing and not sedating, and you have something that's sedating, right? So these are conversations that we're having with patients, and this is language that we're trying to put to a process to make it a little bit more approachable, right?
Sure.
Right? And I think that's what we do well at Keystone, at KCR, and I think that's what goes over well with patients. And further, and I think this is why we want people like Shelley at an organization is and I think like Herman too, quite honestly, is because they want to help people, and they want to use their story to help people.
Yes.
And unfortunately for Shelley in the pharmacy field, is she wasn't able to do that to the extent that she wanted to, and cannabis has afforded her that opportunity. And like Herman, that cannabis is part of you. It's a story, and now you're sharing that with other people. That's the beauty of this medicine, right?
Yeah.
And that's what we try to do is harness that and use cannabis as a catalyst to empower patients back into their own healthcare. And I think that is the largest benefit of cannabis as a therapy. So
just imagine when this plant has been so illegal all these years, when you've had people at home realize long time ago, 20 years ago, that this plant really worked for them, and we call them weed heads, but it was utilized because it was a medicine. Imagine the people that had sickle cell and Crohn's disease and all these other different ailments, and they were utilizing this plant because basically it made them feel better, right?
Mm-hmm.
That's awesome.
Yeah.
And then so we're gonna make sure before we circle back around, where I'm gonna have you explain sativa, indica, and the hybrid again before we leave, because we want to make sure that people have some action items and walk away so they know exactly what to start thinking about and looking for them. Shelley, we talk about for those people that are in the industry or that consume right now, they know about flower and they kind of they know what they want, they know what works for them. It's great. That's about a good 20 to 25% of the population. You got the other 80%, including myself, who's a non-consumer, who I have to really, I'm a non-consumer who's running a cannabis organization. However, so I had to figure out what is, but now I do consume because I have a topical for my back. But let's talk about different delivery systems and why it's important to know what your options are.
Yes, and Roz, I share those same shoes with you.
See,
So yes,
right?
we're
Yeah.
considered marijuana naive.
Yes.
However, very knowledgeable.
Very knowledgeable.
Yes.
I'm the only
Okay.
one in the room that normally I'm like, okay, they was like, you want? No, I'm good. So, you know,
Yeah.
that's
But
only in legal states, guys, and when I'm in
right,
California.
right. Yeah, well, we do have a vast range of ages, even with our sickle cell patients.
Sure.
I have the youngest, actually, I met yesterday. Initially, it was a 24-year-old, but we had one who came into our KCR location out in Stroudsburg, and he was 19.
Okay.
And he was, you can tell, very apprehensive, just kind of had that look on his face of like, you know, I don't know what they're thinking of me or why I'm here. But, you know, as soon as I said to him, hey, you know, just to kind of, you know, to tag on to what was just said, I said, you know, I just did a talk on sickle cell disease and how it works in cannabis. And his face just lit up, Roz.
Yeah.
You know, he started to tell me what hurts, and I want to feel good, and I want to be alert, and I want to be awake, and I want, you know, and I mean, it was a really great feeling. So yes, that level of comfort that, like Victor was explaining, that people get coming into our dispensary and sharing their stories. And we, like I said, we even have a site for them to kind of go back and forth with what works. So far as delivery systems, because of the wide range of ages, like I said, I have a 21-year-old and I have someone as old as 71, sickle cell.
Okay.
So that wasn't a hard sell. It was very easy, believe it or not. You know, just to be able to tell someone, you know, because everyone thinks of cannabis and like you said, they think of a puff of smoke going up in the air.
Sure.
There's other ways in which to use it, and legally in our states you cannot smoke, so everything has to be vaped. So yes, the full body entourage that people enjoy from the flower, they can definitely get that. You know, it's just the way in which you take it in, the way in which it's administered. So you can use flower, just has to be vaped. You can use, you know, you can get the oils, it just has to be used through the, you know, the vaporizing. So you have the fast acting, that's your inhalants. So quick in, I usually tell patients quick out. So like Herman would definitely know and how he has experienced those acute attacks. You want something fast acting, you need to hit that pain, target that pain, and get the relief. However, knowing this is a cycle or condition that is also chronic, you may want to, you know, then transition over to something that's a tincture. Long acting, 6 to 8 hour window. However, it takes a little longer for it to kick in. However, the duration of action is much longer. And then you also, like yourself, using things like topicals. That's another alternative. You know, people that are seniors, they'll definitely try a topical. They'll definitely try a tincture. Just don't give me that smoke. So we definitely can target and speak to every age range and meet them where they're at. So yes, we do. Also, we have gel caps for people who may have difficulty swallowing. You know, we also have regular, you know, capsules. So there's a vast amount. And we also had for a time patches, you know, that people can put a patch on and use it for its long-term use.
Wow. Now, do you guys have edibles in Pennsylvania? I can't remember if that is a part of your.
No, our edibles would be our orals as tinctures and capsules. It hasn't been approved yet, things like gummy bears.
Well, so we have to talk about this. So this is a good segue, because, you know, it's bothering me a little bit.
Okay.
And you guys tell me if it bothers you guys, all right? So
yes, I'm quite sure Victor will have that conversation with you.
Right. So this is what bothers me a little bit, and you tell me what you think. So we're seeing states that are looking at adult use bills and looking at having, you know, called recreational or adult use programs. But what's your thoughts on the medical programs? In many states, they're not pushing to their potential in providing support, not only for things like having edibles and things of that nature, but also having more access points. It just kind of sits in my craw. So what do you guys think about the medical program, and how do we make sure it doesn't get cannibalized by the adult use conversation that's going on, especially in that Northeast corridor, that Pennsylvania, New Jersey, Connecticut, New York, they about to try to get it popping. And we don't want to lose that medical because it's so critical. Your thoughts?
Roz, I'm just happy that you're talking about it, quite honestly, because it's something that's I'm very passionate about. Particularly, Pennsylvania is definitely on the hot track for adult use in 2 years. So one thing we've been doing definitely on a state level is, in terms of that transition, we want to protect the medical marijuana programs, and we want to stop using them as stepping stones to recreational.
Sure.
Right? So we want to ensure our medical corridors and bring cannabis, instead of a last line treatment for someone who's just gone all over the place and this is the last salvage treatment that didn't work, to bring it to a frontline treatment. So that is what's at risk. if we lose the medical cannabis community in an adult use transition. So as KCR, and there are some other organizations in Pennsylvania, and like I said, I'm encouraged that you are speaking about it as well, is that they're of the mindset to protect the medical program. So one big way I think we could do that is to use some of the tax revenue from the adult use program to bolster and subsidize the medical program in terms of certification or even medication costs. So I think that's a huge step in terms of the tax revenue is usually what's talked about in the transition. It is why it's being pushed through now with the budget deficits because of COVID. But let's start using that tax revenue for what got us here. Let's protect our patients. And I think the other thing to give you some encouragement is even Colorado still has a pretty solid patient base and it's been recreational for a very long time, right? The other aspect to it is that the tax is going to be insane for a recreational or adult use market. And as a medical patient, you're going to be exempt from tax. So, and for Presto Doctor, I mean, for your patients, you can show them very easily that your certification fees are actually going to save them money to be staying a patient. And they also have follow-up care through that relationship, which we should be doing in an integrative approach, right? And then being a patient, you won't be charged that sales tax. So you should be, and you're going to be maintaining that type of relationship with your dispensary. Or at least that's what our intention is to be, is always be here for our medical patients.
And there's some states that if you do have your medical card, even the amount that you purchase initially is more than you would be able to purchase if you are just going in from an adult use kind of a recreational type of situation. So any other thoughts about this?
So I agree with a lot of the points that Victor made. Us being in several markets, as you mentioned, sometimes patients can't get access to cannabis. So in Illinois, what we're seeing a lot of patients that were on the recreational side, but still using it to treat something. Now they're coming to the medical side because they can't even get access. The lines are long, and so we're also seeing patients, in different markets. People of color are getting cards because in addition to treating it, it also kind of works as an insurance policy. If something were to happen with the law, now they have a medical card. It's like I'm medicating as a patient, so it protects them in that way as well. But I'm definitely a fan of protecting patients' rights. In the two states that we're in, California and Nevada, also Illinois, that originally started off as medical only and transitioned to adult use, and now they have both programs. There is a decline for a few months. People are really excited. And then after a while, people start to realize that this is something that's legal now. This is an option for me. So we start to see patients of all ages really coming to us and saying, hey, what's this thing? Like maybe they've tried it, years ago. And it's something that, worked for them then, but now that it's legal, they see it as an option.
Yes. That's a great segue. Herman, if you do this on a daily basis, talking to patients, what's our conversation should be to sickle cell community? How do we get people to come out of the closet and look at this as a real option for care to help them to be able to manage this disease?
It's hard because I think for everybody that I've encountered in the sickle cell community over the years, and ever since I've made my transition to just cannabis only, it's really, really hard to get them to come away from the pills. I think that's the main thing that needs to really happen. I always tell patients, even when I'm doing a patient interaction in the dispensary, I tell them, they're like, oh, I want to come off my pills. First, have you consulted your physician?
Sure.
2, the second thing is this is not something where you're just going to jump in and it's going to happen overnight. You have to I tell them, I'm like, you have to want this. This is not just jump in and come off of my pills, because there's literally stages to it. But I think the conversation that needs to be had for sickle cell patients is just how cannabis is going to work against sickle cell. And I think with a lot of the new research coming around for all the different ways to treat it, especially after seeing Parallel announce the whole donation that they did for sickle cell research.
Sure.
I think that is a stepping stone, but I think it's just more education. Doctors should be able to tell, especially recommending physicians should be able to tell a sickle cell patient how it's going to work, as far as how treatment's going to go from step 1, and then also transition into if that patient wants to come off of pills. I usually recommend. I've had patients reach out to me, like sickle cell patients from the community that have just gotten their cards from other states, and they're like, well, I need help. I've had patients from Africa reach out to me and ask me how this is being done.
Right.
I mean, I have some paperwork and that I've like filled out or used to kind of guide myself through it. So all the different strains, different terpenes that I found that actually work the best for me.
Yes.
But I think that's pretty much it. I think it's just more or less it's education behind it and how it's going to treat the disease overall.
Yeah.
Like if it's, yeah, I'm sorry.
No, I was gonna say, just imagine if, and I didn't mean to cut you off, but I just kind of, my brain just went into overdrive. Imagine if we had actual research being done on someone like yourself that has been tracking what works for you, and not only having one person, but we got 2 people, we got 3 people, we got 4 times 10, we got 50, we got 100 people that now can tell us what they've been using and give us feedback as to what's working. I don't know if it's dosing or if it's prescription medicine, but it gives us excuse my language, I'm sorry. Sorry, I'm sorry, but it gives us at least some type of way to understand how, when you're making recommendations, because my kid, for example, just got his card, he's 22, he has no idea what to go ask for. Like, I literally have to go up to school to go, and I'm going to get him connected with Herman, and that's why I asked that question.
Yeah.
I think for me, the main thing that changed everything for me was CBD. A lot of the stuff that we do, a lot of the stuff that sickle cell patients deal with that aren't talked about as well need to be treated. So of course, the depression and the anxiety that's going to come along with having a chronic disease, which everybody deals with if you have a chronic disease usually. But I think also it needs to come down to figuring out, like you're saying, and I agree, is figuring out how it works. Because I went from, and if you're a physician, you know these things. So with sickle cell patients, we have a low hemoglobin usually. We're usually around like a 6 or 7.
6 or 7.
And
yeah,
that's our
5 sometimes.
that's our blood transfusion territory. I'm at like a 12.3.
Yeah, my
which,
son's 11.
Yeah,
Which is
so
not
that's
normal.
extremely high for
Right.
us as sickle cell patients. And I didn't hit those numbers until I actually incorporated coming off of pills and started incorporating cannabis
Wow.
into the regimen. So I mean, it's all research based from there.
Wow.
It's just having the money and the funds to actually be able to do the research to show that it actually works, instead of just pushing pill after pill. I've been on chemo drugs to treat my sickle cell. Why?
Hydroxyurea.
Yeah, exactly. And I actually lost all my teeth. So like all my teeth are actually implanted and everything because I lost all of my teeth to all the pills I've been on. So it affects you, but that's the main thing, is just the research and the funds to do the research and the permission to do it.
Yeah, and we need more than, thank you. I mean, just more and more and more. Victor, were you going to say something? And I was going to ask Dr. Terada something. Were you going to make a comment?
We have an opportunity in Pennsylvania to do the research. So there are academic level research institutions that can get to that level of research that you're talking about on, like, on a physical level, how is it interacting with us and affecting the disease state? But then further than that, is there, I think we can actually do something together. I mean, all three of these, our groups, all 4 of these groups, is we are starting to do longitudinal or contextual studies and survey studies with our patients. And if we want to do one, we could do something that's focused on sickle cell. And
I would love it.
With Prestodoc, we could potentially put that to the entire network of Pennsylvania and not just our patient base. So
I would love it.
We can work something out there, and we are in this early stages of working out our research initiatives that we'll be making a lot of relationships with. So this is exactly the type of things that we want to be looking at.
No, I would love it. Imagine if you did a research and then you get those individuals and you're able to maybe defray the cost to get the recommendation, defray the medicine, but you're being able to give them the feedback, get the feedback from them first to determine what works for each person, and get some, and get some, a baseline. And that's what I was going to talk about you, Dr. Terada. From a baseline, you guys heard Herman say he knows his hemoglobin level. Most sickle cell patients, as you get older, you know what your normal level is. Talk about, Dr. Terada, what that hemoglobin level is and why that's important, and then why with sickle cell it's normally low, and what happens when it gets high.
There we go. Got the mute button on.
Yeah, there you go.
So hemoglobin is important because it's what carries essentially our oxygen to our organs, and every single organ in our body needs oxygen basically constantly. And so when our hemoglobin levels start to drop, it means that the amount of oxygen that can be delivered to any organ starts to really drop, and our body can't function at very, very low levels. I mean, you talk about 4, 5, 6, 7. I saw a kid once with a hemoglobin of 1, and somehow he was still functioning. It also depends on how quickly you go down or up versus, being able to live at a certain number. But that's why these patients who have sickle cell and live at 7 or 8 don't have a lot of wiggle room, to move.
Yeah.
When you get to, that's why you're on these medications, to basically support your A, to protect your immune system, but also B, to sort of prevent your body's own sort of sickling of your blood cells. The fact that his numbers have gotten up to 12 or 13 is phenomenal. Sometimes people would say that's almost concerning to get too high because the blood can sometimes get a little too thick, but that's more 15, 16, 17. So yeah, I mean, it's the reason you don't want it to go too low is because if your organs don't get oxygen, you can only do that for a couple of minutes before you literally start to die.
Right. No, man, it's incredible. You guys, we're almost to a point where the time we need to wrap up. So much good information and content, and just, this is a special population. It's near and dear to my heart, but I think it's a population of people that are dealing with the stress. Some of them are living in economically depressed areas, don't have access, don't have healthcare access points, don't have a dispensary in their neighborhood. There's lack of education, so much. I want to go round robin, and I'll start with Shelly because that's my girl, and I can't wait. I got to come see you. Just what do you want to see for the future in regards to the work that you're doing with Keystone and how we can help to support these patients?
My hopes are to see like the level of the condition itself, because sickle cell is a disease state that has so many pains. It's described as nociceptive pain, neuralgic pain, musculoskeletal pain, chronic pain, acute pain. Just imagining, like I said, I had a brother who, just imagining that amount of pain that one body is enduring at one time.
Yeah.
We know disease states that endure pain, but just imagine taking in all those different disease pain states or pain levels at one time. So my hopes is just to see, it's a disease that's very much pushed to the side. And it's only honestly here in America that you see a more predominant Black population. It does exist outside of the United States. It's just that here in America, it's in the Mediterranean. You have Lebanese who suffer from sickle cells. So you just have to know where you are and what you're seeing. But my hopes is just to see that it becomes more well known and it just not undermined. Because with the opioid crisis right now, and I was talking to Victor earlier about this, it's really getting undermined because doctors have these limitations now of how much they can write. So if you're a sickle cell patient that's been using your opioids or oxys, you're getting less because of what's going on. So your pain, even if it was somewhat met before, it's really not met now. So the education and the knowledge, like we were trying to express earlier, is really key because, cannabis definitely can satisfy a lot of the areas in which people suffer with sickle cell.
Oh, I love it. I love it. And it's bad because even pharmacies will say, well, we don't have Dilaudid. And I'm like, I know, like, every single time my son goes, we don't have it. We're not in stock. So that's a whole nother conversation. Rob, same question, my friend. As we wrap up and you're looking at, with Prestodoctors and serving this population of people that really need you, what do you see and what do you hope for the future? You're on mute. You're on mute. Unmute yourself. There you go.
Sorry about that. So for us, the biggest thing to starting the company was patient access. It was a situation where, at the time we were in San Francisco, and a lot of doctors weren't taking this very seriously. And, learning that, cannabis is a medicine and seeing how it, heals and helps treat certain ailments. It was something that going to one of those physicians at the time, it wasn't someone that I would take like my grandmother to, my mother to, if it was like a serious condition. And so that's kind of what we've been all about. And so, in addition to access is education. We want to educate patients and let them know that, hey, this is something that can work for your condition, share stories like Herman's, and really like make that change. That's really
No, we're so happy to have you, brother. We connected now. You know, I'm about to bug you. Like, come on down to Florida. You got Georgia about to go online with their medical program. You got Mississippi is about to vote on their medical program. That telehealth component is so needed, and especially for our community. So thank you so much for being on tonight, Victor. Same question. You know, in your position, what awesome feeling it is knowing that you have the ability to create Keystone and deliver a service and provide products the way that you want to do it, the way that you would want to give it to your mother or your grandmother, and just to drive that. And where's the future of Keystone? I know Keystone State, Pennsylvania, but brother, you want to come to Florida? I'm trying to get
I would love to come into Florida, but like you said, I mean, there's the monopoly over there. So it's been a very
well, we can talk about that too for
yeah,
2021.
no,
We're trying to break things up.
yeah, no, so I actually have family in Florida. Our plan is to expand into multiple states. So we do think our next big planned move is to make sure we're protecting our medical marijuana program. We will be making a transition into adult use if it comes to Pennsylvania, but it's what our goal is to not actually change our culture in the dispensary and to protect our medical patients. So if that means separate hours, separate entrances, whatever it means, our medical program's always there. But we also want to show that this is not too far off in terms of a wellness approach or a responsible approach if we're going to bring cannabis to the country. But that's a totally separate conversation. In terms of medical cannabis, is what I said before, is my hope is that we can bring this to a point where it's not the last thing that patients are going to seek, and it's the first thing, or at least they're not afraid to explore cannabis as a potential option for an answer or part of an answer to their chronic care condition. That's my ultimate hope, is that, and I think there's still a lot of work to be done there, and you're right to be concerned about those transitions into an adult use market that can disturb that momentum. So my main goal in the next 2 to 3 years, as we're going to see state transition, is to protect that and to bring it more into the forefront of healthcare.
Awesome. Well, if you need a partner, M4MM, definitely your partner. We're with you. We see just by the breadth and depth of the folks that you brought on tonight, we're so grateful to have you guys a part of the family, and let's continue to figure out how we can work together. And last but not least, Herman Brown, man, I can't wait to get you and my son connected. It's going to be awesome. What do you, I mean, your hope, your vision for, you know, you deal with this on a daily basis. And so, and just kudos to you for taking the bull by the horn, stepping out of your comfort zone, figuring it out, owning your healthcare. I always tell my son, own your healthcare, ask questions, drive your, you be in control of what you need for your body to feel better. So same question for you, Herman. What do you want for the future? And as we are talking about being able to give more support to patients who have sickle cell.
I mean, everything that everybody has said, I've totally agreed with, to be honest with you. I mean, it's just more or less like the access to the plant overall. And the education, that's the only two that I really like to see, but also see like hematologists even get on board with like prescribing cannabis or recommending cannabis over all the medications that they're kind of giving us right now as a community, because I think that's what is causing the downfall of the sickle cell community as well, is the opioid crisis. Like, we're in our own crisis because either we don't have access to medication because we've been blacklisted by pharmacies, or it's just we don't have access because of the states that we're living in. Sure. So I'd love to see the access definitely open up to everybody throughout the country.
We need more retail, more doctors in our Black communities. We need to educate our start at the faith-based level, because in our churches, which is the core of our community, you have the moms and the pops and the grandma and and papa that are taking care of, they've either taken care of kids that had sickle cell that are now adults. And let it be known, guys, when the care that you get, sickle cell patients get as a child, and when they become young adults and adults, is totally different. And it's sad, and it makes my heart just hurt. And so I'm so grateful to have you guys on. I can just go on and on and on tonight about this subject. If you guys listen, you're on with Canna Talk with Roz. We've had Keystone Canna Remedies and Prestodoctors, and of course we had our special guest, Mr. Herman Brown. If you're in Pennsylvania, make sure you just go check out Keystone. Don't even just go around everything else. Go check out Keystone Canna Remedies, Keystone State, they're going to be there for you from a very holistic perspective and being able to walk you through your process. And Presto Doctors, you already know, you coming to Florida, brother, but if you guys are needing your recommendation card and needing to have access to a physician, Dr. Terradas, thank you so much for being on. Shelly, thank you so much for being on. Rob, bless you, my brother. Victor, thank you so much. You guys, that's Canna Talk with Rob, special edition. We're talking about it is the National Sickle Cell Awareness Month. Go out, learn more, share this video, support these organizations, support InfraMM, and we'll see you this Friday. It's Black Cannabis Week, so this Friday we got some good stuff going on. So super excited. We'll see you guys Friday, 1 p.m. Thanks, guys. Bye.
Thanks, Rob.